Morning. I want to just introduce my two-day back rehabilitation course, and this is offered both online and also as a face-to-face version, and it covers my 3 R's approach, which I've written widely about. So this is a two-day program for both exercise professionals and therapists, and it takes the knowledge from those 2 camps and combines it into a clinical framework to guide people through the development and practice of back rehabilitation programs. So we start off by looking at anatomy and biomechanics, and we revise and extend that from both camps, from exercise professionals and from therapists. We then look at the way that the spine moves, common misconceptions about movements, and pathologies such as postural changes, discal problems, facet joints. And we look at the evidence-based and use a process of critical appraisal from the research basis and from the basis of clinical guidance. We then go through the models of healthcare, so the way that we view healthcare and how that development can guide our practice. Looking at the 3 stages of the 3 R's approach, we then go on to look at how we teach an exercise and the exercise types that we teach. So we're going to be looking at the principles of exercise teaching from the exercise therapy world and the principles of exercise selection from the therapy world, and combining those 2. And we'll look at various different patient scenarios, patient demonstrations, and come up with the development of programs which are appropriate to the healthcare models. And we're going to be looking through a critical magnifying glass, really, and dispelling some of the myths around back pain and some of the myths around exercise prescription for back pain. So should we, for example, be using core stability? Should we be using postural bases? The language that we use, how these things can make the patient worse when we're trying to make them better. So we'll look at subjects such as kinesiophobia and hypervigilance, and how the fear of bending can be instilled into the patient and make their condition worse, when in actual fact we're trying to make it better. So we'll look at exercises from the Pilates world, from the gym world, from the personal training world, from the therapy world, and we will criticize those, modify those, and structure them into programs. So at the end of the course, you'll have an increased knowledge of anatomy and biomechanics, you'll have an increased knowledge of the conditions which affect the low back, you'll have knowledge of the whole basis of low back pain and how to develop exercise programs for individuals who may come in for therapy to a clinic, individuals who may come into the gym for one-on-one personal training, individuals who may present into classes for yoga, for Pilates, for aerobics, for example. And we'll look at all of those different approaches and come up with a firm structure for designing rehabilitation programs. Okay, thanks very much for watching.